Good afternoon, everyone, and welcome to our community conversation event. Today is Friday, January 8th, and we're very pleased that you're with us today. Today will be an opportunity for you to get an overview on the current status of our stay-home order, the regional stay-home order, that is, from the state of California, as well as an update on our COVID-19 vaccine progress. We will have a panel that features a number of experts, but before we dive into that, I do want to let you know that Spanish interpretation is available for this event. And so at this time, I'd like to invite my colleague, Kellen, to explain to those of you that are watching at home how you can access Spanish interpretation for this event using our Zoom connection. Kellen?
Hola, buenas tardes para todos aquellos que nos están acompañando esta tarde. Si ustedes quieren participar o escuchar esta conversación en español, lo que necesitan hacer, si están utilizando su computadora, oprime el botón que dice interpretación y haga clic en el idioma que desea escuchar, por ejemplo, Spanish para español. Si desea solamente escuchar esta conversación en español con la interpretación, a favor de apagar o silenciar el audio original. Si ustedes nos están participando por su celular y desea escuchar esta conversación en español, a favor de entrar en Zoom y busca los controles de la reunión y toque el más, o sea, son tres puntitos. Ahí habrá de tocar Language Interpretation, o sea, interpretación de idioma, y tocar el idioma que desea escuchar, que es Spanish. Muchas gracias.
Thank you, Kellen. We also will be taking questions during this event. We're going to start out with a panel presentation and then follow up with questions. And so if you have a question that comes up that you would like to ask one of our panelists, there are two ways you can submit questions. If you're joining us via Zoom, you can submit your question using the Q&A button that's at the base of your screen. Simply click on that button and insert your question and hit submit, and then we'll do our best to get through all the questions, time permitting. If you're watching us on Facebook Live, simply list your question in the comments, and again, we'll address that question as time permits. I also want to remind people that if you could use the assistive technology of captioning, that is also available. And so those of you that are joining us on Zoom, you can access that through the closed captions button in your Zoom panel. And for those watching on Facebook, it automatically shows on screen for you. So without further ado, I'm going to go ahead and turn it over to our panel of experts that are joining us today. And you might be saying, who is that? Well, today we have our very own public health officer, Dr. Matt Willis. We also have joining us Dr. Tyler Evans, who's one of our deputy public health officers and chief of our vaccine branch of the Emergency Operations Center. And our panel is rounded out by Benita McLaren, who is the director of Marin Health and Human Services. So with that, Alex, I'll go ahead and have you queue up our PowerPoint. And Dr. Willis, I will turn it over to you to get started.
Good afternoon, everyone. I think, Lainey, I'm actually starting off, and I'll kick it off. Thank you very much. Good afternoon, everyone. I'm Benita McLaren, the Director of Health and Human Services for the County of Marin. And I just want to start off with a few brief comments. The challenges in our nation today and the toll of the pandemic on all of our communities over the past 10 months have been devastatingly great. All of us have paid a big price and suffered greatly as a result of COVID-19. This reality, however, is that the virus continues to spread and has caused suffering physically, emotionally, economically, socially, financially, and more. The loss of life is the most devastating consequence, however. Our county Health and Human Services, county departments, public health team, and our community partners have continued to work tirelessly day and night to respond. Many times we do feel that we are building the plane as we're flying it, but I want you to know that we remain committed to our mission. Next slide, please. The mission of the Health and Human Services is to promote and protect the health, well-being, and self-sufficiency and safety of all in Marin County. And we stand fast on that mission. I want to take just a moment to thank all the dedicated staff in Health and Human Services, Public Health, the County of Marin, and our partners for what they have done, how they've maintained their resilience, and how they continue each and every day. It's truly remarkable to watch and to be a part of. I want to go ahead now and get on with the rest of the presentation today. I want to give you a brief agenda. We will have Dr. Matt Willis come and talk about this new stay-at-home order and the surge and intensive care unit capacity in Marin. We're also going to have Dr. Willis give us an overview of the vaccine and the different phases of the vaccine distribution. Dr. Tyler Evans will come next and talk about the vaccine phases. Dr. Willis will come back and also talk about some of the scenarios about vaccine, and also talk about our how we're doing with our vaccine. Dr. Tyler Evans will also come and back again and talk about our distribution so far, and a little bit more about the efficacy of the vaccine and any issues around vaccine hesitancy. And then we'll wrap it up with some question and answer period. So I want to just at this point, turn it on over to our fearless public health officer, Dr. Matt Willis. And thank you, Dr. Willis, for all you've done throughout this pandemic.
Thank you, Benita, and thank you for your leadership over the Department of Health and Human Services. You know, public health has obviously been almost entirely focused over the past 10 months on our COVID-19 pandemic response. And yet the Department of Health and Human Services has vital services to offer across all different domains of support of our community. And it's been, you know, highly reassuring and inspiring to see how well that work has been ongoing with the public health team being really so dedicated to this one singular focus. Next, please. I'm just going to go over some of the status of where we are right now as a county in terms of our data. I'll talk about the stay-at-home order, which relates to those data elements before we talk about the meat of this conversation is really about the vaccine distribution plan. This is our website that shows our daily numbers. It's updated daily at about 4 o'clock. We've had over 8,000 cases now in the county of Marin since the beginning of the pandemic. Our first cases were in early March. We've now tested over 267,000 residents. 251 have been hospitalized. We've had 115 total deaths thus far. One death approximately every 3 weeks on average since the start of the pandemic here. Next, please. This is our epidemic curve. When we talk about flattening the curve, it's the number of new cases per day. This is by the test date. And what it shows is really three distinct waves. That first wave in March that led to the first stay-at-home order, or that was then called the shelter-in-place order. And then what we all remember is the surge in cases that we had in July. At that time, primarily our essential workers, Latinx, highly overrepresented in that group. About 80% of the cases in that July surge were our Latinx residents. And now we're experiencing, starting in November, even a larger surge in cases than we've ever seen. And this is not just true for Marin, but true for the region, the state, and in fact, the nation. You can see that the height of those bars obviously correspond to the number of cases. And we had by far our single highest day just in the past week, with over 140 cases diagnosed in one day. Next, please. And then this is the corresponding experience for our hospitals. As we see more cases, we would expect to find more people coming into the hospital, and indeed we do. We have the greatest number of people who have been hospitalized in Marin County also in the past week, with 39, and now today it's 38, with 8 in intensive care with COVID-19. Next, please. And this is our three hospitals in Marin. So in response to these surges that are occurring across the state, the governor has instituted a new policy response on top of what you maybe remember as the tier framework with the 4 colors: purple, red, orange, and yellow. We had been in the yellow tier with about 2 to 3 cases per 100,000 residents per day. We are now at, we're about 28 cases, 30 cases per 100. So we're about 15 times that we had been. This is the new stay-at-home order under the governor is instituted when the ICU capacity for a given region, the state was divided into 5 regions. When the regional ICU capacity is less than 15%, that region goes into the stay-at-home order, which is the most restrictive set of policies in terms of the shelter-in-place or stay-at-home that we've had. Exceeds those restrictions that were part of the purple tier, which had been the most restrictive tier. And again, 98% of the population of the state of California is currently in the stay-at-home order, including the Bay Area. Next, please. Bay Area ICU capacity, incidentally, is 3.5% today, which is the lowest it has been. That stay-at-home order is likely to be extended. I'll just speak a little bit more about that before I get to this slide. But the stay-at-home order was due to expire on the 8th. It is likely to be extended because of the trend that I just highlighted. It is the state order, and we're waiting for the state to make that announcement. But we issued a press release yesterday forecasting that we fully expect that order to be extended, given that the numbers are heading in the wrong direction, both in terms of case rates, hospitalizations, and ICU capacity. It would likely be extended indefinitely rather than another fixed 3-week period. And that will allow us flexibility to, if we do see reversals in the trends, either in case rates, hospitalizations, or ICU stays, there's a possibility that that order could be lifted before 3 weeks. But that would require a significant change in the transmission rates that are happening in our community. Having said all that, it's important to recognize that Marin County is still faring better than almost all other counties in the state. This graph shows case rates by county. These are counties that have more than 100,000 residents across the state of California. And ours is the second lowest case rates among those counties, which says something about how dire the situation really is across the state. When we're seeing record numbers of cases and we're in record numbers of hospitalizations, and yet we seem to be in less of a crisis than other counties, it really tells the story of why we're in such a critical state collectively in California and across the nation. Next, please. And this is another way of describing our experience in Marin relative to other Bay Area counties. We have the lowest 7-day average case rate. There's an interesting phenomenon there. If you look at the graphic on the left, you see that there's an increase in cases through December, and then there's a drop, and then it starts to increase again. That notch is attributable to reductions in tests, most likely in tests that would, because of Christmas and then the following weekend, very little testing occurred during that period. So the case rates dropped, but it was really an artifact of the fact that the holiday led to reductions in test rates. And in fact, we've seen a rebound after Christmas, which is concerning and reflects transmission that would have occurred during the Christmas holiday. And then on the right, you see our hospitalization rates. While they are the lowest in the region, every county in the Bay Area is seeing dramatic increases in hospitalizations. Next, please. I just want to call your attention to our website updates. Many of our community members have been interested in following our data. It's one of the principles that we've applied to our response thus far, is really to be as transparent as we can and to share data on our website and in forums like this. And now we have a new interactive feature on our website for anyone to browse that might like to look. It has a slightly different look, but you are able to toggle across interactively to see different time frames. There are new charts that didn't exist before in terms of changes in demographics over time. And for people who are really interested in digging into the data and want access to the databases themselves for their own analyses, you can download data sets at the email address here. And it's also available on our website. Next, please. So just to summarize, our case rates continue to increase across the county, state, and region. Hospitalizations are increasing. Our capacity remains intact in Marin. but it is continuing to shrink. The stay-at-home order is expected to be extended indefinitely, and obviously you know what to do. This is what we've been talking about for months now. Stay at home, avoid social gatherings, cover your face, socially distance, and support local businesses. Next slide, please. And I wonder if anyone knows what these pictures are. This is in 1960. This is the I may be off on that date. It's in the 60s, and this is the polio vaccination day in Marin County. Over 200,000 people vaccinated for polio at that time. These are the Salk vaccine. It was the sugar cube that had the few drops of the vaccine on it, a live virus vaccine. And this was part of a national campaign once the vaccine was made available to cover the community, because polio back in the 1950s was actually a significant source of morbidity and mortality. And it was through the vaccine that we really got, and no one, nowadays polio is an afterthought. And it was through a massive countywide vaccine distribution strategy. And we are here again. And that's what we're going to be talking about next. Next, please. So this is our vaccine distribution mission for Marin County, is to protect all in Marin through an efficient, transparent, and equitable COVID-19 vaccine distribution and administration process, leveraging partnerships. One of the most important lessons of our COVID-19 response so far has been the importance of partnerships between agencies, between sectors, between families and communities. So partnership with public health, our healthcare partners, our hospitals, has been critical. We also will be the principle of responsiveness. We've already needed to be responsive and adaptive in our vaccine distribution plan, because we don't always receive the number of doses we had anticipated based on national supplies and how they may get diverted. And that's been an element of our response all the way along, is needing to be responsive. We're obviously focusing on safety, knowing that the Operation Warp Speed did yield a safe and effective vaccine in less than a year, which is remarkable. But we know that the community also needs to have that reassurance that we're offering something that is safe for our communities. We're focusing on that as well. We know that communication needs to be clean and transparent and frequent, as this forum suggests, and we'll continue to communicate with you as much as we can. And then we're following federal and state standards in our local vaccine distribution plan. Many of the decisions that that have been made are not made at the local level, but actually follow CDC and California Department of Public Health standards, and we are implementing those standards in reaching you in our community. Next, please. So with that, I will hand it over to Dr. Tyler Evans. Tyler is the chief of our vaccine branch. Tyler has been with us for about 1 month. He comes to us from New York City, where he has been working on their COVID-19 quarantine and isolation program at the city level. He has a background in internal medicine, a background in infectious disease, is a huge asset to our team. And we're really fortunate to have Tyler come in and help us as we were doing all the other elements of the COVID-19 response, testing, prioritizing testing, contact tracing, our policy work, our education work. Along comes vaccines, and it was really helpful for us to have new leadership come into that space, working as a deputy public health officer alongside other deputy public health officers who are doing other aspects of our response. And Tyler has been a great addition to our team, and we'll take it from here. Thank you.
Thanks, Dr. Willis. Appreciate that background. So we've got a lot of ground to cover, and we really want to provide some time to really cover some of the important questions and give sort of substance answers. So let's get right into it. Next slide, please. So just sort of a broad overview of the vaccine trials and approvals. There's essentially 6 different vaccines currently in development for COVID-19. 2 of them have been approved. And those 2 are and I'm sure most of the folks have heard about this, but the 2 are Moderna and the Pfizer BioNTech. And so what's unique about both of these is that they're both mRNA vaccines. And so what that means is it's specifically genetic material that's then translated into particularly this spike protein, which if anybody has heard of the concept of coronavirus, corona comes from basically what it looks under a microscope, it looks like a crown. Corona is crown in Latin. And so those spike proteins basically are what's appearing to be the crown. And so those spike proteins essentially then generate an immune response, an antibody response. And then so when the actual virus is introduced into the body, the body kind of knows how to respond to it quickly, and it never actually has an opportunity to make it into your system. So this is really novel stuff, and this is really going to change the game when it comes to what we describe as the global South. Places like sub-Saharan Africa, Middle East, Latin America, where there's a number of vaccine preventable diseases and neglected tropical diseases. So we're really excited about that. And then just to keep in mind that these two vaccines are while they're very efficient, there are four additional ones that are in the pipeline. So we're not done with it. Next slide, please. Right. So, most of what we're responsible for on the, from the local health department level is really, just making sure that the vaccines, as Dr. Willis was describing, are distributed in a way that's transparent, efficient, and equitable. But on a broader level, the concept of allocation of these life-saving vaccines is incredibly important, and is a really important bioethical discussion. And while it's a very sort of important academic exercise, we couldn't really slow down too much, and we really had to kind of be true to its name and Operation Warp Speed and make very quick decisions. So, really most of the decisions, again, are on a national level, and that's through the CDC's immunization branch called ACIP, or the Advisory Committee on Immunization Practices. And so they've really kind of looked at the three pillars of vaccine rollout, looking at science, ethics, and implementation, right? Feasibility. And so how do these components, how are these incorporated into an efficient sort of product or output, and how does that meaningfully get into the arms of Americans? And then, beyond the CDC's, sort of national guidelines, state departments of health then get these guidelines, and then they interpret them within the sort of context of the state's needs. And with respect to California, they've provided a number of different tiers, sort of sub-levels of these phases. And it's sort of word soup, because you hear all these different sort of phases, 1A, 1B, 1C, tiers and levels. But it increasingly becomes important. So phases, that's a federal decision. Tiers, that's a California decision, and we'll talk a little bit more about that. Next slide, please. And and sort of in these decisions, again on a federal level, taking the concepts of safety, this when we look at the clinical trials, and we'll talk a little bit about that, clinical trials for vaccines as a rule have 30,000 participants, and it's really meant to be as sort of equitable as possible. Does this really reflect what America looks like, right, from a demographic standpoint? And so intentionally, it's meant to enroll, parity with respect to gender and communities of color. So safety is thought to be very very rigorous in these study designs, and again very inclusive. And beyond the sort of approval of these, and it's important to note that the approval of these vaccines is not through your sort of standard sort of FDA approval. It was through something called an emergency use authorization because of the need. And so just trying to be as flexible and nimble as possible is important and efficient. Next slide, please. And so, just one thing to really kind of drive home, health equity is something that's so important from a national level, and then down to the state and the local level. And I know that, in Marin, this is something that we spend a lot of time thinking about it. And, we're going to spend a little bit more time talking about how kind of developing, a community advisory board and, kind of using epidemiological principles, et cetera, how we can kind of package all that into an approach that really, really identifies access and equity. Next slide, please. So, again, it goes from the federal to the state to the local health level, and a lot of what we're doing is we're really just being the messenger. We're the sort of the delivery folks, and while we're on a local level, we're sort of coordinating the symphony with other sort of clinical partners. Again, a lot of the policies have already been decided, and there's not really too much wiggle room at this point. Anyhow, next slide. So in terms of how it works in the state, there are 4 different buckets, basically, in terms of receipt of these vaccines. So public health departments like our own is one of those, and that's probably the most sizable. But then there's also your multi-county entities. So like your Kaiser, your Sutter, your UCSF, which receive their own supplies. Then there's CVS Walgreens, which is now covering the long-term care facilities, like your skilled nursing facilities. And then there's the Department of Corrections that is covering the state prisons. So not everything is coming through the local health department, although we are receiving the lion's share, along with the multi-county entities, and really kind of working in partnership with our friends over at Kaiser is very important. Kaiser and others. Next slide, please. And so this just kind of just schematically sort of describes, what does the phased approach look like, from a national standpoint, looking at phase 1, phase 2, phase 3. Phase 1 is so important because that's that adoption piece, and it's a really big lift, right? And it's, there's so many moving parts to it, and a lot of the growing pains on a local, state, and national level we're really trying to figure out in phase 1, so that once it gets to phase 2, which is really the lion's share of the community, we'll have these pieces figured out. So there's a significant learning curve, and I just wanted to sort of bring attention to that. Next slide. So just looking at a sort of timeline, we're again in this phase 1A, and that's really the first 0 to 5 weeks. We started mid-December, so once we get to phase 1B, hopefully within the next few weeks, probably at least towards the end of January, then we can move on to phase 1C, which is probably going to be 4 months out, so maybe April, May, and then phase 2 in summer. Next slide. So warp speed, is it really safe, right? We're getting a lot of questions about this, right, on the local level and on the federal level. So just really being mindful of this speed, and and really kind of socializing this to the community. Is it really safe for our community members? Next slide. And so the most common questions that we get are basically, is the acceleration of the vaccine, the safety, and the number of adverse reactions. And so I'll kind of just go over these really briefly, because I want to have some Q&A about these and really spend a little bit more time. But next slide, please. But the acceleration, despite despite the community's concerns, it really was really sort of methodical and well thought out. Operation Warp Speed, why it's so fast? It's not the clinical trial that was sped up, right? It was the parallel mass production of the vaccines that took place, and so that parallel concurrent mass production, it was really remarkable to know that these emergency use authorizations were approved on Friday at 7 Eastern Standard Time. Monday morning, 8 o'clock Pacific, we're getting the vaccine. So it wasn't it wasn't a lack of sort of foresight in the trials. The trials were very methodical and follow all the sort of scientific, rigorous sort of procedures that we're used to. Next slide. Next slide, please. And the safety when it comes to adverse reactions, allergies, has really been very promising. Less than 5% of folks are experiencing moderate, severe reactions, and most of that is in response to the second dose. When it comes to the first dose, most of what we're hearing is really just local reactions, really just pain at the source, and that's pretty common. Next slide. And then in terms of more severe sort of allergic reactions, anaphylactic reactions, we are tracking that. There's something called VSafe, and of course there will be a few, but there really aren't receiving too many reports of that. And it's just important that folks know that the most important thing is if you've had a severe anaphylactic reaction to flu shot in the past, this is probably not the right vaccine for you. And if you specifically have any allergic reactions to the ingredients in the vaccine, then you should not. But we can, when you're actually getting the vaccine, there's a sort of a more substantive discussion, and there's a questionnaire that goes through some of these. Next slide. And we covered the mRNA vaccines and sort of the confidence in that. And there's a lot of questions about, this genetic material. How does that impact my body? And frankly, it doesn't. It's just it's a very efficient modality to express immunogenicity. Next slide, please. So how do the vaccines get to me, right? And a lot of folks are asking that question. Next slide. So, there's phase 1A, and that's really looking at healthcare workers. So we are, we had, working assiduously on tier 1, and that was really, getting that to hospital facilities, skilled nursing facilities, et cetera. Now we're in tier 2, and mostly it's outpatient healthcare workers. And, the reason why we want to get the healthcare workers is, really twofold. One, we want to make sure that these folks are not going into facilities and getting folks sick, right? And second, we want to ensure that once they start vaccinating other people, that they're protected as well. So it's very important. And all of these you can find on the on our website. Tier 3, we hope to be covering in the next few weeks, and then once we get to phase 1B, next slide. Once we get to phase 1B, that's probably going to be at the end of January, early February, and that's a larger group because that's the general community, 75 and older, and essential workers. Next slide. And then phase 1C, there's a lot of layers to this. Next slide. Like an onion. Phase 2, as we were describing before, kind of late spring, that's kind of a larger sort of populations. Of course, getting to phase 3, that's getting to the general population, and I hope to have that by summer. But, we could always have surprises. Next slide. So, Dr. Willis had talked already about this, but the efficiency, transparency, and equity is really the core ingredients of our thinking in the vaccine branch. Next slide. And true to its word, warp speed. We started on December 15th. We got into the hospitals on that same day. December 16th, we were at skilled nursing facilities, vaccinating the staff. There's a lot of dancing. There was a lot of dancing, a lot of singing, and there's just been really good energy. And where we're at right now is we have a one main point of distribution, or pod, and that's at the Marin Center. And, that is covering the, some staff from basically everybody else in kind of that phase 1A, tier 1, and then getting into tier 2. Next slide, please. So these are this is a number of the doses received, and now this changes every time, every day. So, just be mindful that this is a very dynamic number. So 15,000, next slide. And in terms of doses that have actually been administered or will be administered at the end of, today, it's 14,317. So if you see there, if you look at the difference there, it's less than 1,000. And ultimately, our deliverable, our objective, on a local health department is to get the vaccines to the community as quickly as we possibly can, to not be sitting on the vaccines. So our kind of internal sort of objective is to not have more than 100 vaccines on hand at the end of every week. Next slide. So phase 1B through phase 3, right? Talking about the general community, when is my turn, right? That's a really important piece when it comes to, folks that are, outside of healthcare workers, when am I up, right? So really the four most important factors that you have to think about is occupation, age, medical history, home environment. Occupation, age, medical history, home environment, right? Where do I work? how old am I, what's my past medical history, and what kind of situation do I live in? Do I live in a facility where there's a lot of other folks? Do I live in a congregate? Do I live in a multi-generational home? These are all important things. And in terms of how does that sort of message get to you? There's a lot of different ways. You can talk to your employer if this is an occupational issue. You can talk to your primary care provider if this is based upon just kind of general risk. And then we're going to be having a number of community conversations and town halls as we're having right now. And then of course you can find our website. We have listservs, etc. Next slide. And again, where and how will I be vaccinated really depends on the phase and the tier. The later phases are really kind of working with our hospital partners, working with our federally qualified health centers, working with our clinical partners in general. Might be other vendors, potentially pharmacies, etc. To provide as many opportunities as we possibly can to get doses in people's arms and get them safe. Next slide. So I think that's all, and I think we really want to have those important questions and answers. So I'll just stop there.
Terrific. Thank you for that overview. Well, all of you, Dr. Evans, Dr. Willis, and Benita McLaren, I really appreciate that. And if you joined us late, this is a community conversation that is being held by the County of Marin and Marin Health and Human Services. Today, we are joined by Dr. Willis, who is our public health officer, Dr. Tyler Evans, one of our deputy public health officers and chief of our vaccine branch, and also joined by Benita McLaren, who is Director of Marin Health and Human Services. And I do want to remind everyone, this session is being recorded. So those of you that are Facebook customers, the video will be available on demand at the end of this presentation. Those of you that are not on Facebook, never fear, we will upload both the English and the Spanish interpretation versions to our YouTube channels and make those available in the next 24 hours. If you are a subscriber to our COVID-19 status update, which all of you should be, we will include those links there. And if you're interested in getting updates from us on the COVID-19 response, not only what's happening with our stay-at-home orders and vaccine progress, but other updates from the state, business reopening information, testing, and more, you can subscribe by going online to coronavirus.marinhhs.org/subscribe. Or if you'd like to receive those updates via text message, you can text the phrase, Marin COVID, and there's a space between those two words, to 468-311. Okay, with that, we're going to go ahead and dive into our Q&A. And, Dr. Willis and Dr. Evans, you both can probably help with this. We have had a lot of questions about how do I know where I fall on the tier. A lot of examples given here today about I have this medical condition or this is my living situation. And so rather than trying to go through, there's at least 20 of those questions here. Maybe we can walk through a couple of scenarios and you can maybe explain to the public how they might describe the tier. So Alex, I don't know if you can be quick and jump back to, let's see, I think it's slides, I'm not sure, but the phases. So here's the first example, Dr. Willis. So someone who is a woman, she did not give her age, but for the sake of example, let's say she's 45, in her 40s, and has diabetes. How would she know how to go about getting where she falls on the phase tier, or, the distribution model, in order to know when she'll be able to be eligible to get the vaccine?
Yeah, great. That's a perfect example of the kind of questions we're getting. If we could bring up, if the slide presentation is still available, to bring up the slides where the tiers were represented, we can walk through how I navigate those. I can't myself remember every phase, every tier within each phase. And so
Alex, I think you're going to want slide 34.
There we go.
Maybe that one or the next one.
So that's phase 1A. So this is on our website, and honestly, this is how I answer these questions myself, because I have to always remember. So that was a 45-year-old with diabetes. So, all right, next. So it's not this group. So I will go to the next slide.
Lainey, could I just ask, can I ask if we know occupation or residential status?
For this particular example, I don't have one, but I could make one up based on some of the other questions.
Okay. No, just because if it were occupation, then the phase 1A might be relevant.
Okay.
Yeah.
I'll definitely pull
We'll
in
say
some
it's
of
a
these other examples.
non-healthcare worker. Well, let's have this person not meet other criteria. So
Okay.
so it'll be based on the diabetes and the age will be the primary, because they're not feeding into any of the other groups. So that would be next. So going on to phase 1C, late February or early March, and as you go through and you don't see yourself represented, you recognize that you may be getting further out in terms of when you might be vaccinated. So here I see the second bullet, individuals 16 to 64 years of age with an underlying health condition or disability which increases risk of severe COVID-19 illness or death. And so that's where I would classify this individual in the framework as being in phase 1C, along
Okay.
with people who are age 50 to 64 years.
Excellent. Okay, well, here is another example, because we do have a few, it looks like older adults who are living in independent living type situations. So it's a little bit different than residential care or skilled nursing facilities. So independent living facilities, they don't say an age, but just for the sake of example, let's say between the age of 65 and 74.
You want to take that one, Tyler?
Sure. Yeah. So let's go back to, and, just, I think it's good to, kind of do this systematically, as in maybe exercise at home. So let's go back to that first slide.
1A.
Mm-hmm. Okay. So we've got a, sorry, you said 65 to 74-year-old?
Yeah, I'll say 67 to make it easy for you.
Okay. So 67 lives in independent living. And then do we know about any medical history?
None given, but
Okay.
Can you maybe give us two options? Maybe one, if there is, significant issue that would be of concern versus one that's just healthy?
Yeah. Yeah. I mean, there's a lot, right? So diabetes is a good one. Sort of poorly controlled, high blood pressure, hypertension, right? Maybe an immunocompromising condition, COPD like emphysema, anything like that, or are we just going to go with
Emphysema.
Emphysema. All right. So we have a 60s, and then we talk about residential status, and then occupation, retired.
Sure.
Okay. So we're really looking at phase 1A. Probably not in there because that's mostly healthcare workers and public health staff. So we can move on. Next slide. And then so getting into phase 1B, right? So then, and like I said before, the phases are the national level, tiers are the state level. So we're looking at the tiers in California. And so this person doesn't quite meet tier 1, right? Because not 75. But it looks like that person would be in the tier 2, and I think especially because that person does have that COPD, they would squarely be in the tier 2. And there have been some discussions about these things change. So somebody who's 65 to 74 with we call them comorbidities or risk factors, that might get escalated up to a tier 1, but basically you're either going to be in that tier 1 or tier 2. The independent living that's not going to be a risk factor, so you're fine there. So tier 1, tier 2. So we're looking at late January to early February.
Okay, that's helpful. So based on these first two examples, it sounds like what everyone at home should do is understand those 4 criteria that you mentioned earlier. And so I think it was age, health considerations, such as the diabetes example, occupation and home living environment, and then basically go phase by phase to see, what they may qualify for based on any of those 4 factors. Is that a safe metric for people at home?
Yeah, that's great, Laney. And,
Yep.
and I think, just to really clarify the residential one, the reason why that's important is because, if there's a lot of folks living under one roof, just from a risk factor standpoint, you're going to be living in a denser environment. And so, that you're going to be living in greater risk versus, somebody who's living bachelor, living on their own, then, less risk, right? That person's in one particular space, one bathroom, one kitchen, et cetera.
Can I rip through a couple more real quick?
Sure.
We'll do simple ones. So I'm a teacher, no medical conditions, non-congregate. I'm less than age 65. So there you go. We're phase 1B, tier 1, education. Late January or early February. I work in a restaurant. I'm a food service worker. Phase 1B, tier 1, right? So that's how we're navigating this tool, and people should be able to find themselves represented in this framework. As Tyler suggested, all of this is dependent on the supply we have at any given time. That's why you're given broad time, right? Starts late January or early February, very broad time frames for these tiers. We're going to have probably at least 20 to 30,000 residents just in that phase 1B tier 1. And so if we don't have 20 to 30,000 doses times 2 to offer, then that phase 1B tier 1 will last longer before we get to tier 2. And so that's why we are so eager to be on the receiving end of vaccines here in Marin County. So that's another reason why I think we all need to recognize that there's a certain amount of patience we need to apply to this process, because so much of this depends on just that we have the infrastructure in place to vaccinate. If we get vaccines, we have a tier framework to apply, but we just don't have the vaccines yet to be able to move through these tiers.
Hey, Matt, just for fun, can I give you another scenario?
Yeah.
All right. So let's go back to that first slide. So I'm a 63-year-old female. I'm a public health nurse, and I live in a multi-generational home. And I also have uncontrolled hypertension.
You look like you're getting vaccinated now to me. You got public health field staff right there. That's the one that trumps the others.
Yeah.
And that's, so you could be right now as we speak, you could be at our pod at the Civic Center where we're vaccinating 500 per day. You might be among them.
So if there is anyone watching on this call who does fit within one of the bullets that's on the screen right now under the column vaccinating now, my understanding is you're working directly with those facilities and those employers to try to arrange those pods. So your advice to them, if they have not yet been informed on getting vaccinated, is what? Contact their employer?
Yes.
Exactly. Yeah.
Okay, great. So you heard it here first. Reach out to your employer, advocate that they get into contact with Marin Public Health. If they're unsure what that means, please direct them to the vaccine website or web pages, I should say, we have on our website, which are available at coronavirus.marinhhs.org/vaccine. There's a providers page there, which provides some guidance on how to get in touch with Marin Public Health. This is for medical facilities that are currently eligible for vaccines right now, as well as those that might be independent home health care workers as well. We know that you're not always affiliated with a facility, so we want to make sure that you have that information as well. So thank you for walking us through this model. I think it will help a lot of people who have provided their examples to us for clarification. I will ask, based on the model you provided, should I assume that people who are working in occupations that are not yet defined, so a few that we've seen are music teachers, veterinarians, independent contractors, and others, should we then assume, if they're healthy, that then they would take into consideration their age and health, I guess I should say, to know where they fall on the chart, and that we should not necessarily expect that every single occupation will be defined at some point?
Yeah, I think that's fair. And just kind of going categorically like we did with identifying, kind of what group that you're in terms of getting the word out there. Lainey, you mentioned the important one right now, which is the employers, right? Because that's really identifying, again, from an occupational standpoint, one of those four sort of metrics of risk, to see whether or not they're currently being vaccinated or they will be soon. But another really important one is having that discussion with your primary care provider, right? And to understand, okay, well, I'm not working in a high risk environment that's described on your website, but I have these medical issues and I'm not sure if that qualifies. Best thing to do is just talk to your medical provider. And then finally the having these conversations I think help. Having the website helps, and then I know there's a listserv. So there's a lot of different, I think, opportunities to kind of understand where folks are at. So I think the most important message that we want to give to people is that there's a lot of different people working together on this, and people are going to get covered. It's going to happen. So we really want to socialize the message that we're going to get to everybody in the fastest, most equitable way we possibly can.
That's helpful. Thank you for that. Is there a waiting list to sign up for in order to get the vaccine?
There is not a waiting list. There is, if you are in the phases or the tiers and you have been notified, then you can start scheduling. And we don't have to go into too much detail on that, but you can start scheduling. And then there is a process where you can be kind of like in standby, but there is no current waiting list.
But we do want to remind people that this information that Marin Health and Human Services is providing on this vaccine resource center is updated frequently. So the best way to track progress through the phases is to keep an eye on that website, specifically that distribution model, which you can access. I think it's the first button you land on when you arrive at that vaccine webpage. And you can also subscribe for those COVID-19 status updates that I mentioned earlier. The Marin Public Health is very good about providing updates about where we are in the vaccine process. And as those tier changes are made and new options for getting the vaccine are available, those are things that will be broadcast out there. So that's something you can get notice right there in your email box. So look for that resource as well. I'm going to shift away from the tiers a little bit because we do have other categories of questions that have come in and want to definitely try to make time. We've had well over 250 questions come in, so I can tell you we probably won't have enough time for all, but I do want to remind people on that website is also an FAQ that answers a lot of some of these common questions that you're asking, and we'll use some of the questions that you've asked to help inform future questions. So another reason to go check out that website. So there's a question about the vaccine doses that we have received and allocated so far. You showed those very detailed tables, Dr. Evans, about how many doses we've received and how many have gone out. And I'm curious if you can shed a little bit more light on what that process is. When we receive the doses, what happens to them? How long do we have them before they actually are distributed into the community?
Sure. So so it's sort of a whole algorithm. We have a plan. We have a plan set up, right? We have and the most important sort of function of that plan has been the pod, that point of distribution. So we had one, for example, for the first responders. Now we have one that's kind of our ongoing pod at the Marin Center. 10 Avenue of the Flags, and that is, and so that again, that's the point of distribution. We get the vaccines delivered from well, it's allocated by the state, but essentially the trucks are coming from either the Pfizer or the Moderna plants, and it's really it's interesting because there's an actual kind of almost war room that people are watching on the East Coast around the DC area to watch these kind of trucks, because this is so important from a logistics standpoint, to watch these trucks and ensure that they're getting to the right place. Once they're received, there's a whole cold chain. I won't get too much into that, but the Pfizer, requires a little bit of a colder environment. And so, the logistics there is a little bit more challenging, but then we basically receive them. We work with the hospitals, we work with the outpatient facilities, or we work with the pod, and everybody's on cue, right? So we know exactly the minute that we get it, we're logistically kind of turning this stuff around and putting it in everybody else's freezers, and then their plans are set up, and they're going the next day, and the vaccinations are getting into the people's arms. So, and this is just going to get broader and broader, but most of what we've been doing so far has been, hospitals, skilled nursing facilities, and the pod. So, yeah, I mean, our plan is really, it's fast.
And as a follow-up to that, is it part of our practice to then, I know we're moving quickly, and the California Department of Public Health even updated today, the importance of moving through these phases as quickly as possible. So when we get the vaccine, the question is, do we also hang on to some in order to later give a second dose, or do we wait for that second dose to come in at a later date?
That's a good question. So the second doses are actually allocated they're reserved by the state. So they are kind of put on layaway, if you will. And so whether it's, depends on the timing. So Pfizer's is 21 days after the first dose. The Moderna is 28 days. So depending on which one it is, you're going to get at least equal supply from the state for the Pfizer and Moderna respectively. So that's for your second doses, and then we ultimately have a plan for the first and second doses. So for example, next week, our first responders will be getting their second doses at the pod, but then at the same time, we will be giving first doses to, outpatient healthcare workers, home health staff, et cetera.
That's helpful. I know you mentioned, both you and Dr. Willis mentioned an equitable lens on this process. And we have a question specifically asking about some of our most impacted community members, which are Latinx or other communities of color, and wondering, what efforts are underway to ensure they have the access that they need to the vaccine.
Anita, do you want to address some of that?
Well, one thing I will say, thank you, Dr. Willis. I will say that I think that we've done a remarkable job of trying to follow the state guidelines, which really were developed with those issues in mind, and so that we could impact those communities that were most heavily hit, including our older adult population. The other thing that we're doing here in Marin, and Dr. Evans can talk about it, he's the, I don't know if I should say godfather of our community advisory board that we will be developing soon. And part of that board effort will be to make sure that all kinds of voices are heard in our communication, in our distribution, in our allocation, and in our work. So we're going to make sure that we get some community voices. But we are greatly following the state's directive really closely as possible. And I think we're keeping equity at the forefront of what we want to accomplish here in Marin to make sure that our communities, especially ones hardest hit by COVID-19, get the opportunity to get the vaccine as soon as possible. So I don't know if you want to add anything to that, Dr. Evans.
Yeah, thanks for that. I think when it comes to the principles of health equity, one of the reasons why I came on board at Marin was because I understood, that what a core principle that is. And from a personal and professional standpoint, this has been a constant in my life. And so, we know that when it comes to infectious disease outbreaks, there's consistently been disproportionate impact on communities of color and sort of more broadly, what we describe as the social determinants of health. And that really just amplifies the sort of chronic disparities that exist, across the U.S. and really across the world. Communities of color are often sort of impacted when it comes to COVID. Latinx, African Americans, are significantly higher risk of, not just infection, and the reason for the infection is essentially, occupation, residential sort of, facilities, et cetera, but adverse, sort of events once they're infected, right? So, So being mindful of that, you know, we really want to have our community advisory board really be as representative as it possibly can be, to identify all these, not just communities of color, but, you know, faith-based community, substance use, LGBTQ, et cetera. Really just look, you know, have this community advisory board really be representative of what we look like in Northern California and America, right? And so all the voices are heard. And essentially, when it comes to kind of pointing our vaccine cannons, as I describe it, you know, we're looking at the rubric from the federal and state level, right? And there's not too much sort of wiggle room that we have there. We have to follow our orders. But then the second part is really looking at the social determinants of health that we were just describing. And then the third is looking at the epidemiological landscape, looking at see where is the prevalence taking place, and why, and which communities should we prioritize. And presumably the last two components, the social determinants of health, will probably dictate or determine where you're going to have higher levels of community prevalence, and then we can prioritize those communities within the rubric that we're following.
I think that, just the other thing to add on to that is that a lot of our communities of color do fall in these early phases and tiers because of their work situation. So we are seeing a lot of people of color already getting the vaccine. So I think that's also a positive thing. Thank you.
Can I just add some specificities that observation, Benita, which is when, you know, one of the hardest hit sectors has been our food service workers. We've seen a lot of transmission in that environment. It's one of the occupations that we know is one of our highest risk occupations, frankly, at the county, and was one of the reasons why we took some earlier action around restaurants in our shelter-in-place policy. But it's also a sector that employs many of our lower income Latinx residents. And so the fact that the state prioritized them as that early tier is a reflection of that recognition as a statewide reality. And so that's going to be an early example of taking an equity focus on this to really make sure that we have real penetration in that, you know, across our food service industry, so that we're reaching all those individuals who are at risk for the vaccine.
That's helpful. Thank you. Well, I don't want to ignore the fact that this was a two-topic town hall. One was on vaccines, and the other, obviously, our stay-at-home order. And so I do want to address a few of the stay-home order questions that have come in. Now, Dr. Willis, I did see there was an update in the middle of your remarks, actually, that the state does plan on giving an announcement sometime tomorrow. So fingers crossed we'll have some clarity there. But I think you can tackle some of these questions even without that update from the state. So we have had a handful of questions specifically around this topic, which is very frankly, why are Marin County outdoor restaurants, why is outdoor dining closed in Marin County?
Yeah, the simplest answer to that question is that we are operating under the state stay-at-home order. We had adopted the stay-at-home order a week before the state imposed that order upon us, recognizing the trends we were seeing in terms of our ICU capacity. Once ICU capacity got beneath 15% for the region of the Bay Area, the state imposed that stay-at-home order. We were the fourth region in the state to go into that status. And we remain in that status, and our ICU capacity continues to decline since it was declared 3 weeks ago. And that is the policy in that stay-at-home order, is that restaurants, both indoors and outdoors, are closed. So we don't have a choice to open outdoor dining until the state stay-at-home order would be changed.
And this might be kind of a bold question. Hopefully you'll indulge me in this, Dr. Willis. I know I've thrown you some curveballs in the past. What would be the ramifications if Marin County decided to say, we're just going to do our own thing and not follow the state order?
Yeah, there's a whole division of enforcement that's been ramped up at the state level, and I had some conversations with the state yesterday about this. There is a lot at stake. The state has, we rely upon the state for funding for our response, both for, for the staff, but also so other resources that we rely upon, our housing resources that we're able to offer people who need quarantine and isolation, the income replacement that we're able to offer people who can't work, the resources for contact tracing, vaccine supply itself comes to us from the state. So the state has significant leverage in terms of our ability to maintain our COVID-19 response. And so when the state issues an order that is law at the state, it is not something we would do lightly or should take lightly at the local level if there was any thoughts about violating those laws.
Has the state indicated at all that if ICU capacity continues to be as dire as it is, or maybe even worse, that it will tighten up that stay home order to be anything closer to the shelter in place order we all experienced in March?
We have not, we can sort of preview what our experience might be based on what happened in Southern California, because their order preceded ours and was extended last week. And there were no changes in the nature of the order itself in Southern California last week. So, and we have not been signaled, that there would be any change in the policy locally, either more restrictive or less restrictive than the current one.
Okay, that's helpful. Let's see. It looks like there are some questions about clarifying the nature of the order. And for the sake of the now 280 questions we received, I will refer people back to the coronavirus in Marin website. That's coronavirus.marinhhs.org. If you land there and scroll down to public health orders, there'll be a link you can click to get the nitty-gritty details about what is allowed to be open and what isn't allowed to be open under the current state regional health order, state regional stay home order, that is. So we'll save that time for that, but please go check that out. And there is also a resource there for understanding exactly what the capacity is in each region around California. So I want to dive back into the vaccine side of things, because we have had a number of questions. I know we just have a couple minutes left. As you probably heard in the news just this morning, President-elect Biden made some bold statements about the availability of the vaccine. And so we've had a number of questions wondering if, when President-elect Biden takes office, if you anticipate that having any effect on our vaccine distribution. I know it's a little bit political, but I don't know if there's any forecasts that you have heard of for your colleagues from the California Department of Public Health.
I mean, the only thing that I could say is that we've seen a lot of I guess fattening up of staff and on a national level, really smart thought-provoking leaders that I think will have a much different response. And so I would imagine that vaccines really being the end all of the pandemic, that we will expect a more collaborative and efficient sort of ramp up of where we're at. And so we're hopeful, right? We don't have answers. We're hopeful, and we're getting a lot of our information is the same as the general public. I think. I do have to say though, in terms of where we're at right now, in terms of Operation Warp Speed, we've been pretty pleased with the results for the most part. I know there's a lot of controversy over this, but this is the first time, as Dr. Willis was mentioning in the beginning, it's the first time that since development of trials and ending and mass production, it's the first time that a vaccine has ever been that's all happened within a year. So this is really sort of unprecedented, and yes, there are naturally going to be some issues with that, but we feel like it's gone pretty well. Could it go better? Yes, and I feel like it will. So
great. And then there's one more question I want to squeeze in that sort of has to do with the tiers, but it's different than anything that we've covered. And I think it's important given the global ecosystem, if you will, of the Bay Area, where we often have residents of one county working in a different county. So the question is, are the phases and distribution tiers consistent across all counties in the Bay Area? And if not, how do I know which model I should use to get vaccinated? Is it the one in the county in which I reside or the county in which I work?
That's a great question. We get that pretty often. So yes, the phases and the tiers are the same throughout all of the entire state. The interpretation of that could change. We have not heard that there's been much variability, but as I was describing earlier, once we get further down through the phases, the local health departments will have some ability to be a little bit creative with respect to, again, social determinants of health and where the areas of prevalence are. With respect to people that are living, in one county, working in another, which, of course, happens frequently in our globalized world, it's going to be based upon your risk factor. So getting back to that sort of rubric of, age, medical history, occupation, and residential status. If your risk factor is based upon residential status, then it's going to be the county of residence. If it's based upon occupational risk, right? So for healthcare workers, if, for example, you lived in San Francisco but you're working in Marin County, then it would be the responsibility of the county where you're employed. For the most outside of that, if it's age or medical history, it's going to be based upon your county of residence. So really, the difference is if you're employed in Marin, then it's our responsibility.
That's helpful. Thank you. I do want to assure everyone, I know we're just about out of time, and I do want to give Benita McLaren a little bit of time to wrap up. A lot of the questions that we've seen come in are answered on the FAQ that is offered on our website, and I'll give you that address again. It's coronavirus.marinhhs.org/vaccine. So just click on the FAQ button, and we actually have a couple of pages of FAQs, so make sure you scroll to the bottom and hit next. But for what we can see, a lot of those questions are answered there, and we've taken note of your questions that if there's some new ones that we haven't quite answered yet, we're going to take those back to our team and see if we can get them added there so that we can continue to make this an ongoing resource, living, breathing resource for all of you.
Lainey, so can I prompt one last question?
Yes.
Which is, can we does this mean that we don't need to do this stay-at-home order elements? If the good news is the vaccine is coming, are we off the hook? We hear some questions like that, and I think this conversation has illustrated how slowly things are moving. We are still in less than a small fraction. We're dealing with very limited supplies of vaccine right now. We are still only partway through phase 1A of a multiple tier process that will eventually get to all of our residents, but it will be months. We are experiencing a crisis of surges in cases and hospitalizations and ICU capacity. And so it is critical that all the things that we've been doing to protect ourselves all along, we double down on those things. We're talking about the silver lining here, the light at the end of the tunnel, but we cannot wait for that. We have to continue to do all of the things we're doing for the last few months, physical distancing, avoiding indoor social gatherings. That's the single most important contributor to transmission right now in Marin County, is people getting fatigued, missing their friends, missing their relatives, and getting together indoors socially across households, and it is hurting us. And so that's, I think, an important message for us to carry forward in all of these conversations, because again, it will be months before we have enough protection at the community level to rely upon that.
Thanks, Dr. Willis.
That's
all right.
And Lainey, and one other thing too. This comes up often. It's to that same point. We get questions all the time. If I get vaccinated, do I still have to socially distance? Do I still have to wear a mask? Do I still have to, kind of wash my hands rigorously? And the answer is yes. Until we actually have a more sort of, concerted approach to the end of this emergency, yes. And hey, it's not a bad thing to be, have a little bit more rigorous hand hygiene, right? It's going to help us all out for for other infections. So.
Great point. All right, with that, Benita, I'm going to hand it over to you.
Yes, thank you, Lainey, and thanks to everyone for joining us today on the community conversation. It's been a great conversation and a lot of information provided. As we close today, I just want to say, that we really appreciate all the residents of Marin County, their interest in these issues and what they can do to participate. I think if anyone is still wondering about whether they should get the vaccine, I just want to remind you that what I said at the beginning is that, the COVID-19 has really taken a toll on all of us. The virus continues, as Dr. Willis mentioned, out of control. And we all know firsthand some of the heartbreak and pain of losing loved ones, the toll on our healthcare workers, on our public health workers, and on all of our businesses and communities. We have to do our part in trying to stem this virus from moving forward. So I encourage you all to really consider these things, do your homework, do your own investigation, find the information that you need. Our website has a lot of information. I really encourage you to go there and get more information to answer your questions. But we're here for you, for Health and Human Services and all the County of Marin to keep you safe and healthy and to provide you the best living possible. So thank you everyone again for joining us.
And thank you for that wrap up, Benita. It's been great to have all three of you here with us today. And we want to thank you for your time, as well as a quick shout out to our wonderful team providing not only the ASL interpretation, but our Spanish interpreter and our live captioners. We really appreciate you being here as well. So with that, I will give you one last reminder for all the latest information on exactly where we are in our COVID-19 response. That main website URL you need to remember is coronavirus.marinhhs.org. And then really after that, all you have to know is the slash. So for vaccine information, it's /vaccine. For testing information, it's /testing, and so on and so forth. So do keep an eye on that vaccine webpage. As I mentioned earlier, it's updated frequently with ongoing information as it's made available to us. And again, I really want to encourage all of you to consider signing up for our daily status updates, for those ongoing updates as we make progress through this, what will likely be a several-month vaccine process, as well as new updates from the state, public health orders, business reopening guidance, updates on schools, and more. You can subscribe to those updates by going to coronavirus.marinhhs.org/subscribe. And again, there is a text message there as well, text message option. So with that, we will wrap it up, and we hope to see you again at a future community conversation event very soon. Until then, stay safe, and thanks for watching, everyone.
Bye.